This video is going to be on thrombopathy, which is platelet dysfunction. Platelets can be dysfunctional because of an intrinsic platelet defect or an extrinsic platelet defect. Intrinsic platelet defects are very rare, so for this course we're not going to learn about any of the intrinsic platelet disorders. The most common thrombopathy is an extrinsic platelet defect known as von Willebrand's disease. If you remember from the hemostasis lecture, the subendothelial collagen has lots of von Willebrand factor molecules, so that when the endothelial cell becomes compromised, the subendothelial collagen is exposed and there's exposure of the von Willebrand factor molecules. These are the molecules that bind platelets. But if these factors are absent or if they're dysfunctional, then it results in von Willebrand disease. There are 3 types of von Willebrand disease recognized in animals, and they're called type 1, type 2, and type 3. Type 1 von Willebrand disease is a deficiency of von Willebrand factor. Type 2 von Willebrand disease is when von Willebrand factor is present, but its structure and function is abnormal. Type 3 von Willebrand's disease is when there's a near absence of any von Willebrand factor. All animals present with signs of hemorrhage such as epistaxis, GI bleeding, urinary tract bleeding, and also petechia and ecchymoses of the mucous membrane. But the type 1 disease tends to be mild to moderate. Occasionally it's more severe. And type 2 and type 3 tend to be the more severe forms. The screening test for von Willebrand's disease or a thrombopathy is the buccal mucosal bleeding time. This test requires adequate platelet numbers and adequate platelet function. However, if you want to confirm von Willebrand disease or a thrombopathy, you really need to send out for special testing.